Dan, welcome to the show. Thanks for joining me. I mean, the UW hospitals and clinics are basically saying, yeah, we know. We're just going to redefine it and see if we get caught.
Yeah, this is UW Health, and they have on their website, under the Social Impact and Belonging page, they have a video, a very helpful video from their vice president that was just released, and she calls social impact and belonging the, quote, next phase of DEI. And the purpose of them rolling this out is to ensure that DEI, quote, endures well into the future. So they are not hiding this at all. They are not hiding the fact that social impact and belonging is just a rebrand of DEI. And actually, it's an expansion of DEI. And the UW-Madison, the university, they use the phrase inclusive excellence is what they have rebranded DEI as. But this one at UW Health is virulent. It includes gender reassignment services for children. They say pediatric transgender health is part of social impact and belonging. They have race-based community health programs where they hire Black female community health workers with these grants where they say that they're helping, quote, 200 Black birthing persons. So they can't even say mothers. So it's quite an expansion, actually, of DEI into the transgender field, the transgenderism and activism. And the racialism of providing health care to people. And, everybody who goes to the doctor should be wanting to get the best care possible. And DEI is now being pushed into how doctors actually treat you to make sure that we can reduce any racial disparities among groups, which is not great for individualized health care.
So if we go back to what Scarlett was talking about in the education system, you've got a whole bunch of people who have no, professional basis, who are just working on political ideology, inducing children into believing that they are the opposite gender or some alt sexuality. And then those people, tell the parents, or if they tell the parents, maybe they don't tell the parents because they would violate the law that way as well. Suddenly that kid goes to, let's say, University of Wisconsin hospitals and clinics. And University of Wisconsin Hospitals and Clinics says, oh, yes, your gender identity is the only thing that matters here. And so we're going to promote, quote, gender identity services for young people. So interesting pipeline we've got working from the schools to the hospitals to the medicalization of all of this. One wonders whether they've done the bottom line calculation on, quote, making sure DEI endures into the future. And incidentally, none of this is legal.
Yeah, this is all illegal, and we've been filing complaints with the RFK's HHS to get rid of race-based DEI in the Cleveland Clinic, Johns Hopkins, Cincinnati Children's Hospital. These are hospitals we've been finding all around the country that have been using race as a way to sort of balance out the results. What they do is they find that there are racial disparities in kidney disease or heart disease or liver disease, and so they literally want to change the outcome so that the races have a balance. And so if you're a patient and you want to get treated for a disease, I don't think you should be worried that the doctor is maybe giving you less treatment.
Yes.
Or less good care so that maybe your result will balance out the fact that there are other races doing more poorly, which should terrify everybody that the DEI is being inserted into our healthcare.
Well, and exactly. And that is the worry, because that is the inevitable conclusion of what social impact and belonging, inclusive excellence, DEI means when it comes to healthcare. There's a disparate impact. We're going to artificially alter that impact by not helping Black people with diabetes or whatever, but by reducing the positive outcomes on non-Black people with diabetes. That's how it works. That's the worry about this. The gender stuff also under this gigantic umbrella, but all of these things have been individually addressed either through executive order or multiple Supreme Court decisions, not just one, but multiple Supreme Court decisions. But what they're saying is, we don't care. Sue us. They figure enough of this is going to survive because there just aren't enough Dan Lenningtons in the world to force compliance. I mean, I hope you guys go to the mat on this and force compliance, because this is you don't have a choice in healthcare any longer in southern Wisconsin if you're UW Health. I mean, everybody's merged. They're all the same entity at this point.
Yeah, and they keep out competition. They basically act like utilities. And so, yeah, this is a real problem. And what we have described this as is that we have won the air war. You know, we have the Supreme Court saying that you can't discriminate based on race. We have the president issuing an executive order saying it's the policy of the federal government that all people are treated equally and that there's only two genders. So we have sort of air coverage from our federal friends now, but now we have the ground game. We have to go house to house, and we have to go and root out DEI, root out illegal transgender policies from hospitals and universities and places where people are becoming victimized by these radical left-wing policies. So yes, we are in the ground phase, and it just reminds your listeners that we have to be vigilant, and we have to keep putting resources into rooting out all these discriminatory and harmful ideologies from our society.
Because it's a revolution. That's what we're talking about. This is revolution. This is revolution in the French Revolution style. Revolutionaries don't just say, oh, an executive order, I guess I'll stop being a revolutionary. And we are talking about, you know, a huge number of people with enormous access to power, whether in it's education and it's healthcare, enormous access to power. And so, you know, the idea that, well, everyone's, you know, Trump said X or the Supreme Court said this, you should just comply. No, that's what we do. We just comply. They don't. They say sue us, and they are totally willing to risk losing federal funding, because that's in the end what both the Department of Education, or I'm sorry, the Department of Public Instruction is putting Wisconsin schools at risk of, and that's what University of Wisconsin is putting itself at risk of with regard to health and to the hospital and clinics.
Yeah, this is that's the big hammer coming from the federal government right now is that we're going to take away your federal funding, and that, you know, for schools, that's a lot of money. Public schools, K through 12, is about 10% of their budget. You know, universities have a lot more money coming in the door through student loans. Hospitals are mostly funded by the government. Almost all hospitals have, you know, 50, 60, 70% of their revenues coming in from the government somehow because of Medicare, Medicaid, TRICARE, and those expenditures. So, yeah, this is a big hammer, big threat. But, yeah, this is a Marxist ideology. And as Kamala Harris has still on her X feed, DEI means an intention that we all end up in the same place. That's what they want. When you hear social impact and belonging, when you hear inclusive excellence, it's just like Kamala says, we all want to end up in the same place. Well, I don't want to end up in the same place. I want freedom. I want liberty. I want individuality, individual rights, and I want the government to protect us with the rule of law. I don't want to all end up in the same place. That's people end up in the same place, end up in gulags, and I don't want to end up there.
That's a good point.
We have to keep fighting this ideology wherever it rears its head.